Hey everyone, it's Dr. Kevin Wafer with Core Chiropractic in the Energy Corridor. And today we have another episode of our Ask the Doc segment. And today the question is, why do we take x-rays? And to answer this question, there's really two separate reasons that we take x-rays here at Core Chiropractic. Number one is for your safety. We want to make sure that there's nothing going on in their spine that would keep us from treating you or that we could potentially make your problem worse. We're thinking about things like broken bones, anything in the spine that's growing that shouldn't be there, like a tumor or cancer. Unfortunately, in my history as a chiropractor, in the last 10 years, I found 3 cases of cancer on patients by taking an x-ray, and in all 3 of the cases, they had no idea that they had cancer. Now, had I not taken x-rays and I went ahead and adjusted them, I could have made their problem much, much worse. So number one, we take x-rays for safety. We also look for all the things medical doctors do. We're looking for spinal degeneration to see if there might be any cases of disc loss. We're also going to check your posture and see what things look like there. But what the second thing, and what really separates us from a lot of chiropractors in the area, is we do a lot of x-ray analysis. So if you look at this x-ray, this is an x-ray here of a lumbar spine, the lower back facing forward. So we've got right hip, left hip, pelvis, tailbone, and each bone in the lower back here. So each one of these numbers on this screen means something to us as chiropractors. It tells us where your misalignments are and what we need to do and where we need to make the adjustment. That's what separates us from other chiropractors. Anybody can adjust you. Anybody can just crack your spine, move things that don't necessarily need to be moved. But we take an analysis of the x-ray, we know what the biggest problem is, what needs to be adjusted, and what doesn't need to be adjusted. The other thing that separates us is we don't just take an x-ray at the beginning of your treatment. Towards the end of the treatment, after 6 months, a year of treatment, we come back and we do follow-up x-rays. And are your x-rays going to be perfect at that point in time? No. But we'll definitely be able to sit down with you and show you progress to where your spine is in better position. You've got better posture. And we've been able to prove that not only are you better, not only do you feel better, but we can show that your x-rays look better too. So these are the 2 reasons why we really take x-rays at Core Chiropractic. 1, we want to be as safe as possible. And 2, we want to know exactly what needs to be adjusted, and we want to be able to show progress down the road. So if you have any questions about x-rays in particular, feel free to leave them in the comments, or next time you're in the office, feel free to drop a question in the fishbowl, and I'll be sure to answer it in the next week. So hope everybody has a great rest of the week, and I'll see you next time.